Hi, good morning, Wakefield. Happy Friday. Welcome to our COVID update call. Town Administrator Mayo is on another call right now, so I'm going to lead you through the updates today. Before we hand it over to our health director, I did just want to let everybody know that we're going to move to a bi-weekly schedule again. So today, if you're watching this recording, it's November 5th. So we'll see you again on the 19th and then again on December 3rd. Of course, if anything comes up, we can pop another call into one of the off weeks, but bi-weekly schedule moving forward. So I'll hand it over to our health director who will review some of Wakefield's trends. If you want to see some of the numbers for town, you can go to our website, wakefield.ma.us. There's a COVID tab on the top navigation, and you can run through these. So Anthony, I noticed that the numbers were a little bit up this week.
Yes, thank you, Jen. So, good morning, Wakefield. So in terms of the cases this week and just looking at the past few weeks, we've been seeing a slight increase in the average daily cases. And so this trend is a little bit worrying as we are still following a lot of our rules with contact tracers helping out to reach, for quarantine, any kind of questions around isolation and testing questions. But in the community as well as the schools, we're starting to see a slight increase in cases. And so as we head into the holiday stretch of November, we do want to make sure that everyone is aware that there are resources out there to help guide you through quarantine as well as best practices with COVID. We're currently at 7 average cases per day. Currently, we have 86 active confirmed cases. As we go down to the vaccination report, we haven't seen a whole lot change in the vaccination rates for most age groups. The most exciting news, obviously, is the 5 to 11 approval most recently, and this will definitely impact the numbers in a positive light once we are able to roll that out to the community. We are seeing an increase in the positivity rate as well for testing, and so this is not necessarily a bad thing. It just means our testing is working better. So if you have symptoms, please err on the side of caution and try to go get tested as soon as possible. And just for everyone's information, the PCR test is still considered the gold standard. So if possible, go and get tested. Some of the news that concerns everyone here in Wakefield is the 5 to 11 vaccine that was approved. The 5 to 11 vaccine has been shown to have a 90.7% effectiveness in preventing COVID in children 5 to 11. The safety of the vaccine has already been shown. They've done a study where 3,100 children were involved in the ages 5 to 11, and no serious side effects were recorded. And so this is obviously an ongoing process. They will continue to do more studies and track the data for 5 to 11-year-olds in terms of vaccinations and COVID, and we will be able to provide more information moving forward. But the vaccine is safe for that age group, and there are multiple places to get it. We are working on receiving the vaccine here in Wakefield, and we will be putting together a clinic to serve that age group. But currently, if you are looking to get the shot, there are several locations nearby. There is a CVS in Melrose on Main Street, as well as a CVS in Wakefield on Main Street. They are taking appointments, and the vaccine is available, so you can go there and make your appointments now.
Thanks, Anthony. I happen to have 2 children, and their pediatrician's office is going to be doing a clinic as well. So I encourage folks to check in with their kids' doctors to see if maybe there's opportunity there as well. Superintendent Lyons, do you want to review some of the school data?
Sure. Thank you very much, Jen. This week in our schools, we have 19 students positive cases. We have 19 students and 1 faculty member. Total new cases this week are 20. Numbers in quarantine, we have 99 with 98 students and 1 staff member. The majority of the cases, or a larger number than the other schools, continues to be Galvin. So we are very much looking forward to the 5 through 11 vaccination kind of opportunity, and I think a number of parents are as well. So we think that will cut that number right down in that age group. So we're looking forward to that. The total number of cases for the year to date, since the start of the school year until now, are 105 students, 14 faculty and staff. I also learned late last night, so we report weekly to the Department of Elementary and Secondary Ed every single Wednesday. It's a requirement of all schools in the state. And so we've updated our numbers, just as I'm doing here right now. And it looks like that the total, I don't know exactly how this happened. We're going to be working with them this morning, but it looks like our total numbers were put in the wrong space. And I don't know how this happened, but it looks like we're reporting 105 student cases this week, based on the spreadsheet that is kept by the Department of Elementary and Secondary Education. That is in fact incorrect. So if you are a parent that references both the Wakefield data dashboard and the information that we're sending out from schools from our school system, and also to the Department of Elementary and Secondary Ed, which correlates with Mass DPH, the total numbers for the year are 105 students and 14 adults. And we will work on correcting the DESE database this morning. So other than that, appreciate all the help. Anthony, I think you've been really just a wonderful resource for us. Thank you as well for also guiding parents that have had questions and that have reached out just in regard to understanding the scenarios around close contacts. I would also say that if any parents are watching, if you do have questions about the scenarios or close contacts, or as a corollary, the student work that your child might need if they're out of school, please don't hesitate to contact your principals or your school nurses. Other than that, that's it, Jen. Thank you very much.
Great, thanks, Superintendent Lyons. Just a reminder too that school administration hosts an update call for families every Thursday afternoon. So if you do have any questions, you can feel free to hop on those each Thursday. We have our Emergency Management Director, Tom Walsh. Do you have anything to add?
Yeah, each week I get on and I ask people, I request them to get their vaccination. And now we have a great thing coming on with the 5 to 11-year-olds. If you have questions about your child, everybody's children are unique, ask your pediatrician. You go call if there's any questions, and they'll tell you what they think. They've been looking at your child for a while. My own personal thing is this, you hear people say, do this, but they don't do it themselves. When I was eligible to get my shot, and my wife as well, we got it right away. I have 4 children, they have 4 spouses, they are all fully vaccinated. I have 9 grandchildren from the ages of 5 to 15. 3 have already been fully vaccinated because they're the age of 12. And yesterday, 4 of my 6 already got their first shot. So please, if you have get out there and do it. Any questions, ask your pediatrician, call our public health director, they'll take care of you. But please, get the kids in, get them their vaccination, please.
Thanks. And to wrap it up, we have a member of our Board of Health, Laurel Gorville. Do you have anything that you'd like to tell the fine folks at Wakefield?
Just keep up the good work. We are moving indoors. Airspace is closing in on us a little bit. So, continue your fresh air movement. It's so interesting regionally to see how people are responding to masking. And I spent a lot of time in Maine, and, at this point, I think it's a courtesy, if whether or not we have virus and there's no way to know who has it and who doesn't, it's really become a sign of courtesy in that regard. We are still in flu vaccine season, so kids probably should be, really focusing on getting flu vaccine now. It's not a bad idea to space these out a couple of weeks, but again, pediatric practices, pediatric nurse practitioners, family nurse practitioners, and medical doctors, pediatricians, will really guide you in that regard. Just so that it used to be that health departments were the main provider of vaccines. And ever since H1N1, when we deputized pharmacies to manage vaccines, we really have just been spreading out our ability to get vaccine. So interestingly enough, over the years, even though the health department has managed an awful lot of vaccine clinics, Our flu access, we order them every year, and we have until this year. We haven't looked at this year's numbers yet, but we're seeing some trending down because you can, we have a vaccine clinic on a such and such a date. It's kind of hard, we don't do it every day. Pharmacies do, but we do like to continue, and we do intend to do a family flu clinic. Anthony, I don't know that we've nailed down that date. And then the timing, our hope is to get that first vaccine for COVID provided, if you haven't had access already, kind of the week after Thanksgiving, which would bring that 3-week point to just before Christmas vacation. And that's kind of the sweet spot because of so many family gatherings that happen. Now, just remember that, vaccines take some time in your body to actually have a robust response, but it's certainly better than nothing. So if people really try to get their vaccine earlier than later, my hope for the schools is that, by February vacation, we'll be in pretty good shape. And I would really hope there's an impact. There's studies out there, but they're really not New England studies. And I think that the idea of vaccines is very regional. New England seems to be more of a pro-vaccine per capita place, thankfully. I'm glad I live here. So, kids are used to vaccines. They're used to responding to vaccines. If anything, they're more pros at it than adults are. So I'm really looking forward to seeing how this really switches things up, because bottom line, when we look at hospital numbers, having COVID is much worse than having, for sequelae. And this is a new game, and it's evolving. So stay well, and we look forward to helping be part of the solution.
Great. And I think I read that it is safe for someone to get their flu shot and COVID vaccine on the same day.
That is true for adults.
Mm-hmm.
Anthony, I just reviewed, we have brand new CDC information on COVID for kids. I need to verify that, Jen.
At the moment, I don't have confirmation that for kids you can get them at the same time. I think I also need to go look at the CDC data for that. For adults, it is okay. You can get the flu and COVID together. It would, side effects for those, just after getting any shot might not be advisable, but you could. So we'll look into the timing for the flu and COVID for children.
Excellent. Our town council chair, Julie Smith-Galvin, did have a work commitment, but she wanted me to extend her thanks to everyone and keep up the best practices. So before we leave, just a reminder again, we're not going to see you next week, but we will see you on November 19th. So thank you, everybody.
Wonderful. Have a good weekend.